Most men will notice a distinct structural change in their physical anatomy as they cross into their late 30s, 40s, and beyond. It is an observation made in the quiet moments of the morning, often accompanied by a sudden, unspoken anxiety. You may notice that the physical carriage of your anatomy has shifted, specifically that your testicles hang noticeably lower or that the skin of the scrotum lacks the tight, responsive elasticity it possessed in your 20s. Because men are socially conditioned to equate a high, tight physical carriage with youth, high testosterone, and peak vitality, this natural elongation is frequently misinterpreted as a biological failure. It is a silent worry that men carry, fearing it signals the onset of infertility, a drop in masculine energy, or a permanent decline in their physical capability. If you have experienced this shift and felt that quiet concern, you are not alone, and your body is not failing you. As an expert in male physiology, I can tell you that this structural change is not a sign of weakness. It is, in fact, evidence of a highly sophisticated, beautifully designed biological thermostat working exactly as it was engineered to perform. I am Dr. Iris Amelia, an andrology specialist. My clinical focus is the intersection of aging, vascular health, and the preservation of long-term male vitality. Today, we are going to remove the anxiety surrounding this extremely common physical change by looking at the exact mechanical and biological systems at work. Authority over your own health requires understanding the quiet mechanisms of your body without the noise of societal myth. To understand why this shift occurs, we must first look at the unique structural engineering of the male reproductive system. Unlike almost every other vital organ, which is securely protected deep within the warm core of the body, the testes are suspended externally. From an evolutionary and structural standpoint, this is a highly vulnerable position. So why did human biology design it this way? The answer is thermal optimization. The biological processes that occur within the testes, specifically the synthesis of testosterone and the production of viable, healthy sperm, require an extremely precise environment. Your core body temperature hovers around 37 degrees Celsius. However, the enzymatic reactions required for optimal spermatogenesis will degrade and fail at that temperature. The testes require a microclimate that is strictly maintained at 2 to 3 degrees cooler than the rest of your body, ideally between 34 and 35 degrees Celsius. To achieve this, the body relies on a dynamic two-part muscular suspension system that acts as an autonomic climate control unit. The first component is the Dartos fascia, a layer of smooth muscle tissue located directly beneath the skin of the scrotum. The second is the Cremaster muscle, a biological sling that physically raises and lowers the testes. These muscles are not controlled by your conscious thought. They are entirely governed by your autonomic nervous system and are incredibly sensitive to ambient temperature and systemic stress. When you are exposed to cold temperatures or when your nervous system detects a physical threat, the Dartos and Cremaster muscles powerfully contract, which shrinks the surface area of the skin to prevent heat loss and pulls the anatomy tight against the warmth of your pelvic floor. Conversely, when your core temperature rises, whether from a hot climate, a heavy workout, a hot shower, or even prolonged sitting in a modern office chair, these muscles deliberately relax. The skin expands, increasing the surface area for maximum heat dissipation, and the anatomy lowers, physically distancing the testes from the radiating heat of your core. When you observe your anatomy hanging lower, you are not looking at a loss of vitality. You are observing your autonomic nervous system actively protecting your reproductive and hormonal health. It is a sign of a responsive, functioning system. If this thermal regulation happens at all ages, why does the physical carriage change so noticeably after the age of 35 or 40? This is where we must discuss the biological reality of cellular aging and structural integrity. As you age, your body undergoes a natural decrease in the production of collagen and elastin, the structural proteins responsible for the firmness and snap-back quality of your skin and connective tissues. Decades of gravity, combined with this natural reduction in tissue elasticity, mean that the resting state of the Dartos fascia becomes naturally more relaxed. The suspension cables of your anatomy naturally elongate. This is a normal physiological evolution of the male body. Just as the skin around your jawline or eyes changes texture over the decades, the specialized tissue of the scrotum also matures. The danger lies in how men interpret this physiological fact. Many assume that this laxity directly correlates to a drop in testosterone or a decline in physical performance. performance. Let me be unequivocally clear. Normal structural elongation has absolutely no negative impact on your ability to achieve an erection, your physical performance during intimacy, or your baseline testosterone production. A lower carriage does not equal a weaker man. While a lower resting carriage is a normal hallmark of male aging, it is vital to distinguish between healthy physiological adaptation and potential vascular pathology. As an empowered man, you must know what your baseline looks and feels like so you can identify clinical red flags. It is entirely normal for one side of your anatomy, typically the left, to hang slightly lower than the right. This evolutionary asymmetry prevents the testes from compressing against each other during movement. However, you should pay attention if this elongation is accompanied by specific physical symptoms. If you experience a chronic, dull ache, a feeling of heavy physical dragging in the groin, or if the veins within the scrotum suddenly feel enlarged, swollen, or resemble a bag of worms to the touch, you may be experiencing a varicocele. A varicocele is an enlargement of the pampiniform plexus, the network of veins responsible for draining blood from the testicles. When the one-way valves inside these veins fail, blood pools, causing the veins to distend and raising the internal temperature of the testes. While a varicocele does not automatically mean infertility, the chronic heat and poor circulation can eventually compromise both sperm quality and testosterone production. Similarly, a sudden, painless swelling on one side could indicate a hydrocele, which is an accumulation of fluid within the protective sheath surrounding the testicle. If you notice these specific warning signs, pain, distinct swelling, or highly prominent veins, it is not a time for quiet anxiety. It is a time for logical action. Consult a physician. A medical evaluation is not a judgment on your masculinity. It is a routine maintenance check on a critical biological system. To support the structural health, vascular tone, and neurological responsiveness of this delicate system, I recommend a specific physiological practice. Every video I produce introduces one practical, evidence-based habit to support your biology. Today, we're going to utilize a technique I call thermal vascular conditioning. Because the Dartos and Cremaster muscles are heavily reliant on optimal blood flow and autonomic nervous system signaling, they benefit immensely from controlled thermal stress. Your habit is simple. At the end of your daily shower, turn the water temperature to the coldest setting you can tolerate. Direct the cold water over your lower abdomen and pelvic region for exactly 30 to 60 seconds. This is not about enduring pain, it is a mechanical exercise for your vascular system. The sudden exposure to cold forces an immediate, powerful constriction of the local blood vessels and a rapid contraction of the Cremaster and Dartos muscles. This acts as a physical workout for the smooth muscle tissue, helping to maintain its responsiveness over time. Furthermore, the cold exposure triggers a systemic release of noradrenaline, a neurotransmitter that clears mental fog and resets your autonomic nervous system from a sluggish state to a state of sharp, grounded alertness. When you implement this thermal conditioning into your daily routine, the physiological timeline is highly predictable. Week 1. The initial shock of the cold will be intense, but you will immediately notice a physical tightening of the local anatomy that lasts for several hours, proving that your muscular suspension system is still highly responsive. You will also experience a sharp, clean boost in morning mental clarity. Week 2. The cold exposure will become easier to tolerate. You will likely notice a general improvement in the resting tone of the physical tissue, as the regular constriction and dilation exercise the smooth muscle fibers. Week 3, many men report an improvement in localized circulation and a more grounded, stable physical energy throughout the day. You are effectively training your body's thermostat to remain highly responsive, preventing the stagnation of blood flow that can contribute to varicoceles and general fatigue. I want to leave you with a critical shift in perspective. The mature male body is a landscape of accumulated experience and biological wisdom. We must stop expecting a 50-year-old physical structure to perfectly mimic a 20-year-old structure. The elongation of your anatomy is not a failure. It is evidence that your body is expertly prioritizing the internal temperature required to protect your cellular health. Masculinity is not defined by rigid, unyielding tissue. True True, quiet, masculine authority is defined by how well you understand, respect, and maintain the incredible biological machinery you have been given. When you understand the science, the silent anxiety disappears. You are functioning exactly as designed. I am curious, have you ever found yourself quietly worrying about these natural physical changes simply because no one ever explained the biology to you? Your honesty in the comments helps build a community of men who rely on logic and science rather than fear. Understanding your localized circulation is vital, but it is deeply connected to your systemic blood flow. If you want to understand the silent cardiovascular habits that are quietly destroying male energy levels after the age of 40 and exactly how to reverse them, watch the video appearing on your screen now. I am Dr. Iris Amelia. Thank you for your time and your focus.